And today we're going to find out more about May being recognized as Mental Health Awareness Month and the Mississippi Department of Mental Health's Behind the Mask campaign. Joining us in the studio is Miss Molly Taylor. She's Director of Division of Outreach and Training for the Mississippi Department of Mental Health. And Molly, I said, May's a busy month for you guys, huh?
It is, Rebecca. Thanks so much for having me.
Well, I think it's great to be having these conversations, right? When you start talking about mental health, you think, oh, this isn't the good stuff. And I go, it is, because we need to raise the awareness. We need to make sure that you know all the tools and resources out there, if not for you, for a loved one. And to me, that is the definition of good. So let's talk about this month. What does it mean for you guys to sort of raise the awareness of mental health during the month of May?
Yeah, so May is Mental Health Month, and it's really just a good time for us to educate and remind people that our mental health is something that we should all care about. Everybody's got mental health, and we have to take care of our mental health just like we do our physical health. If we're not doing well physically, then we're probably not doing too well mentally. And if we're not doing well mentally, we're probably not taking care of our physical health. So they really go hand in hand. And May is just a good time to remind everyone that we need to take our mental health seriously throughout the year.
I totally agree with that. And you guys have a great new campaign. That's the Mississippi Department of Mental Health, Behind the Mask. Now, before you change the channel, it's not about mask. It's about what? Because I feel like we got a little bit of COVID fatigue going on, but it's not what you think. Stick with us. It's about what all happened as just a result of, living 2 years or a year and a half in what felt like the Twilight Zone.
Yeah. I think anybody who's experienced mental health problems before, depression, anxiety, people will tell you that you often put on a mask. So even before COVID, before we were talking about wearing masks, people with mental health issues often put on a mask to disguise what's happening in their lives. And so this campaign is really about taking off that figurative mask and not being afraid to reach out for help if you're experiencing stress or anxiety or grief from the loss of a loved one due to COVID. When during the COVID-19 pandemic, we were all experiencing so many new things and maybe new emotions, new stresses, new anxieties that we had never been through before. And so,
And they all happened at once.
Yes, it did. You're exactly right. I mean, people experiencing job loss or the shift that everybody had to do, frontline workers had to do in terms of in healthcare, but also our teachers, our retail workers. And those people are incredibly affected by mental health issues now because of the pandemic. And we may not realize it, that the reason that we're experiencing maybe more stress or the reason we may be crying more often or have an anger outburst could be because of our mental health problems. And so Behind the Mask is really a campaign that encourages people to seek help for mental health problems. There are resources available throughout our state. And the Behind the Mask website is a great resource to go to help kind of assess maybe if you have a mental health problem. There is a screening that you can do, an anonymous screening that just kind of asks you questions and gets you thinking like, okay, maybe I do need to see someone. And then there's a great map on the website that can tell you what providers are available in your area. So it's a really great place to turn.
I do appreciate the figurative language of behind a mask, Molly, because I think we've all been there in acute phases in our life where maybe you're not feeling the best emotionally, but you get up, you put your lipstick on, you put the smile on your face, you go to church, you go to work, you do all the things, and even friends or family go, "How are you doing? How's it going?" "Oh, I'm fine, just tired," whatever it may be. But on the inside, you're struggling, and I think it's normal to go through those ups and downs as a person. I think when it becomes a problem is when it doesn't go, like when you're 6 weeks in or you're 6 months in and now we're 2.5 years later and you feel like you're still having to like buck yourself up to find the good in each day.
Yeah.
And I think, to understand that there's help for that. And it doesn't have to be lifelong therapy. It may only take you a couple of sessions to learn the ways to handle the emotions, and then you get back control of your life.
Absolutely. And I mean, you're right on track with, it's not a lifelong commitment. I mean, you can go and see a therapist. They may recommend medication. You can even talk to your primary health care doctor about medication to help with depression. We do recommend that if you're taking medication, therapy along with it is a great combination. But you're right, it's not a lifelong commitment. But just like physical health conditions, our mental health, when we have problems with our mental health, they have to be treated too. And the earlier that you can seek help for, the symptoms that you're experiencing from a mental health condition, the more likely you're going to get it taken care of a lot quicker.
I wish I knew where I saw this number, but I didn't make it up. But 42.7% of adults in Mississippi have reported symptoms of anxiety and depression. So if you feel like you're the only one, you're definitely not. And some of it is the fact that we are doing a good job of raising more awareness about it and still having to fight maybe that stigma, because there's this idea that if you have high blood pressure, you go to the doctor, you get it taken care of. If you bum your knee up, you go and see, whoever you need to. There's no shame in that, unless you felt. I mean, I guess there's ways that it could be not the best story, but it still feels like there's this level of surrender that has to come with asking for mental health. You mentioned that it was anonymous. What about some of the other resources there? I mean, do you always have to go to a caregiver to get help through the website?
No, I mean, you can contact, there are local community mental health providers throughout the state. In every county of the state, there's a mental health provider there, but there's also private providers, like certified providers who can provide services as well. But BehindTheMaskMS.com is a good place to start, because you can click on the county that you live in and it pulls up a list of the providers, the mental health providers in your area. And that's just a great place to start when you're looking for mental health resources. And when I mentioned that it's anonymous, there's a screening tool online that's on the website that's anonymous. And so it's a good way to kind of assess where you might be at and kind of help encourage you, hey, maybe I do need to see someone.
And two, there's so many now, thanks to the pandemic, which it's ironic to say because the pandemic may put you in this chronic state of stress or anxiety. But one good thing that came out of it was the heightened ability or awareness around telehealth. Mm-hmm. And Mississippi leads the nation anyway already in that because of our rural counties and trying to get to quality health care providers. But now more therapists, more physicians, more things of that nature offer virtual options that they didn't offer before. Mm-hmm. So even if you think, I can't be seen going into a therapist's office or have the time, mm-hmm. I get that. Now you may be able to find a provider that can FaceTime you. There's all kinds of apps for that now, and meet you where you are literally, so you feel a little bit more secure with it.
Yeah, a little more comfortable with it. You're absolutely right. The thing about seeking mental health services is the hardest part is taking that first step. Mm-hmm. Calling somebody, seeking out services online, whatever it takes. But that's the most important step, because the longer that you have to deal with the burden of mental health issues, the harder it is for you. And, the sooner that you can see somebody, the sooner you can start feeling better. And, isn't that what we all want? So we really want to encourage people to seek out resources, and BehindTheMaskMS.com is a good place to do that.
Well, I think it's a good thing, too, that at least it's being recognized that this is an issue that's not going away. Just like your high blood pressure is not going to get better if you don't get it treated, your depression's not going to get better if you don't get it, under control or sort of treated. And I think, too, Molly, we're jumping to the conclusion that you're going to have to get on medication, you're going to have to do all that. It may not even necessarily get to that route. Your anxiety may be from high blood pressure. Yeah. So if you don't go to your primary care provider and can't get that under control, then it may not even be what you're terrified of it being.
Absolutely. I mean, you can learn, just like you mentioned earlier, new coping skills, that can kind of help you kind of learn ways to deal with issues and deal with the symptoms of mental health. There's no one size fits all remedy for everybody. It just where you are, a therapist or a physician is going to meet you there and help you through that.
And I know Behind the Mask isn't your only resource you have for folks around mental health, so we've got that and more coming up next with Molly on Good Things. Good Things wants to encourage you to go on an adventure in Mississippi, so go to visitmississippi.org to find out more. Don't forget you can watch SuperTalk Mississippi on your computer or your mobile device. You can watch it on Roku, Amazon Fire TV devices, even YouTube. If you've got C Spire TV, you can find Good Things on Channel 70 right next to the Weather Channel. And if all else fails, just head on over to supertalk.fm/connect to find out more. And we're getting more information behind the Mississippi Department of Mental Health's Behind the Mask campaign. It's promoting mental health services for us who may be experiencing mental health or substance abuse issues linked to COVID-19. So it's not necessarily about COVID. It's kind of about just how the fact that our lives over the last 2 years got put into a whirlwind and in a blender. Not everything came out necessarily the same. And I think once the dust has settled, because I feel like we are, Molly, kind of over that hump where it feels like it's settling, that's when you realize some of those lingering, heightened emotions haven't left, even though your life may look like the closer to what it did pre-pandemic, and then you may have something that needs to be handled.
Yeah, you're absolutely right. I mean, there are definitely lasting effects of the pandemic when it comes to our mental health. And, as we talked about earlier with, so many of us have lost loved ones due to COVID, or we've experienced changing in jobs or our child's education or whatever that has looked like. It's so important for us to take advantage of resources that are available and seeking those mental health services out.
And especially the more discreet ones, which is what Behind the Mask MS website is. It's a discreet way to tip your toe in the water of trying to figure out how you can move forward and getting some freedom from some of those mental health strains, and specifically looking at certain careers that kind of had it rough. We all had it rough,
yes.
But some careers maybe had a little tougher than others during the pandemic. Who are you guys really trying to get this information out to?
So Behind the Mask is for anybody in Mississippi, but we know there's a lot of research that's shown that there have been extreme demands on employees of frontline fields of work. And a lot of times when we think about frontline workers, we think automatically of healthcare workers.
Which they are. But...
Absolutely are. But you also think about their support staff, so clerical staff in those healthcare environments, or the environmental services staff, the janitorial staff who work in those hospitals. All of those people have been affected by higher stress during the pandemic. But then you also think about mental health care workers, retail employees, law enforcement and first responders, those who were dealing with transportation issues and still are, honestly, educators, childcare workers, people in the media. These are all people who...
Yes, we are. Yes.
Absolutely. Who have experienced more stress during the pandemic. And, we want everyone to know that mental health services are available, but especially for those folks to think about kind of the effect that the added stress of the pandemic has had on their mental health. And, if you are feeling more stress, more anxiety, crying more often, more anger, know that it is okay to ask for help. And this does not have to go on forever. Mental health problems are treatable. They are very common. 1 in 5 people will experience some type of mental health problem in their lifetime.
And it can be acute, meaning that it can be taken care of and then you move on with your life. Bubba from Meridian, Molly, reminds us that everyone should be honest with their physician and they will not look at you necessarily differently. And there's so many of us who just don't want to unload that burden, or we feel like we're just venting or whatever it may be. But your physician, your OB, whoever that may be, your pediatrician, they need to know what's going on, in your home. So just be honest with them to start that conversation.
Absolutely. And when your doctor says to you, how you doing or how you feeling, talking about your physical health problems kind of comes naturally when you're sitting in a physician's office, but you may not think to mention your mental health problems, or that you've been feeling, or even that if you're feeling more tired, or, some of those things can be attributed to physical health issues, but also to mental health issues as well. So it's a good time to talk with your physician about
And
that.
brain fog would be another one I would add. But Carol says mail carriers, the package load is much more now. They got bombarded. And I'll say another one that's maybe a smaller population, but that they definitely felt the weight of the pandemic was your individuals who run your local or small nonprofits, whether it's your food pantries, food banks, to clothing closets that, they saw, and then they have that heart of giving already, and then to know that they have more need than they can, meet, really weighed on so many, and still struggling to keep themselves safe during that acute time. Right. And so I feel like they kind of fell under the radar of folks who really took a lot on during that time to help those in their worst. And if you want stories or personal stories or to see how other people have dealt with it, there's some on the website too.
There are. You can go to BehindTheMaskMS.com to read testimonials of people in Mississippi who sought mental health resources during the pandemic because of the extra stress that they were feeling. So it's a good way to kind of feel like, okay, this is normal. Somebody else has experienced this too. And so it's a good way to read those stories. But there's also lots of good tips on the website about how to take care of your mental health, along with that screening tool that I mentioned earlier. If you enjoy a survey, this is a great one to take because it really can kind of get you in tune with what you may need to check in with on your mental health.
And if you have maybe employees or, you lead a group of people, y'all have a mental health first aid training?
Yes, there is a mental health first aid training. It's a great evidence-based curriculum, and we have been really fortunate to get grant funds over the last several years to provide it to people who work primarily with youth, but then also more recently, those who interact with adults frequently. So there's two versions. There's a youth mental health first aid and an adult mental health first aid. And so both of those are available at no cost. And the training really teaches people who don't work in the mental health field. I mean, that's what it's intended for, just lay people out in the community, how to help someone who's experiencing a mental health or a substance use issue, and how to connect them to resources. And so it's a excellent training. It's a day-long training, but it's a commitment, but it is one that teaches you how to feel more comfortable with helping someone who may be experiencing mental health problems. And so we can provide that training at no cost and would be happy to do that for you.
But you never know when you're going to come across someone in the public who you could be their knight in shining armor or their, angel in disguise by just knowing how to approach the situation, de-escalate it, and then, get them to the next steps that they need.
Yeah.
Let's talk about the mental health meetup. You mentioned that's a cool event coming up.
Yeah. So we're really excited. On May the 25th at 2 o'clock at the two Mississippi museums, we're going to have a mental health meetup. And we're partnering with the National Alliance on Mental Illness to hear from peer support specialists. These are people who have lived experience. So either they themselves have been affected by mental health issues or substance use issues, or they have family members who they've experienced mental health problems. And so you're going to hear stories, personal stories from them, along with getting more resources, getting more information about the resources that are available in the state. And so it's just a good time for us to come together and meet up and, socialize and hear about what's happening around mental health in our state.
Talking about it and bringing it into the light is the first step to, breaking the stigma, making it more common for folks to ask for help. That's exactly what we're trying to do here on Good Things. We have several chiming in saying restaurant managers had to shoulder a very large load. What I love is the fact that you guys recognize that, hey, there was just this burden that was placed upon us, not only just the virus, just everything else.
Absolutely.
And you weren't created to carry that alone. And I think that's the point. You don't have to figure it out by yourself. Someone else also said maybe physicians don't always take females particularly seriously with mental health issues. I would say find another physician. And I would say encourage too. We have a lot of gentlemen who listen to Good Things, and if you know that the women or the teens in your life or whatever it may be, you can be a great champion for saying, hey, babe, find somebody else who will take you seriously. Just that little bit of encouragement, validation that, she may be crazy, but maybe not that kind of crazy. And to keep looking for or seeking out the appropriate help.
Yeah. And, that's really an encouraging word for people who may have family members that are dealing with mental health problems who maybe don't recognize it themselves. A lot of times we listen to our loved ones. We listen to our friends. We listen to our family members. And we take their advice and their encouragement more seriously than maybe some random person on the radio, So, if you are someone who does have a family member that you're concerned about, talk with them. Let them know that there are resources available. Let them know you'll go with them, to an appointment, or help them find, a provider to see. Because, a lot of times doing it by ourselves can be really scary. But if we have the support and love from our loved ones and the understanding, which is what Mental Health Month is all about, is really reducing the stigma around mental health issues and bringing more understanding around it.
And I would say, too, making sure that you don't just ask once, "Are you okay, hon?" and she get the nod. Stick with it if you know that. And you can go to behindthemaskms.com for more information. Molly, this has been a treat.
Thank you.
I appreciate you.